Welcome, everyone. On behalf of the American Academy of Social Work and Social Welfare, we're thrilled that you're joining us. We'll begin in a couple of minutes. And Peter, it is always good to see you because you are the very top of the agenda. So wonderful. Stephanie, on your lead, we'll begin.
Okay, great. Thank you all for being here with us today. And thank you all to all of our attendees. We'll be starting our discussion here in just a moment. If you have questions for our panelists, please feel free to put those in the chat. And we will have time for Q&A at the end of the session. We also will be recording this session and it will be posted to our open classroom website, as you can see here. And then it will also be shared on our YouTube channel as well. So we look forward to sharing that with you. We'll go ahead and get started. I will also add this link in the chat and the link to sign up for the other sessions in this series of webinars. This is the first of our webinar series on the 21st century agenda, and we'll be talking more about what that entails as we get started. But if you are interested in attending any of the other sessions, I will post the link as well for those, so you can sign up for those. And we have several panelists that will be joining us today. So I'm just going to introduce the folks that are here on the call with us from our AASWSW team, the American Academy of Social Work and Social Welfare. We have Sanjam Dot, Nicholas Asher, who are our program coordinators today. Also, Mary McKay. Thank you, Mary, for kicking us off this afternoon. Mary's the former president of the board of the American Academy of Social Work and Social Welfare, the vice provost of interdisciplinary initiatives at Washington University in St. Louis. And then we have our panelists and moderator for today's discussion. We have Julia Henley, who is the Samuel Dutch Professor and Deputy Dean for Research and Faculty Development at the University of Chicago. David Alexander, Director of Research at Illinois Action for Children. Teresa Hawley, the Executive Director at the Center for Early Learning Funding Equity. And Sindhu Ramalingam, from the Senior Policy Advisor at the Division of Early Childhood at the Illinois Department of Human Services. And then joining us as moderator as Peter Pecora. He is the Managing Director of Research Services for Casey Family Programs and a professor at the School of Social Work and University of Washington. And also, importantly, for today's discussion, a fellow at the Academy. So we're so thankful to have all of you here with us today. And I think I will turn it over to Peter now to share a little bit more about the 21st century agenda. Thank you.
Thank you, Stephanie. Welcome, everybody. Just a little history here. Since May of 2019, a diverse group of researchers, DEI experts, people with lived expertise with the child welfare system, and some policy experts have worked together to identify research gaps, the most highest priority research gaps, to enhance the development of what would enhance the development of a 21st century approach to child and family well-being in the United States. So it was an ambitious endeavor to sort of create a research agenda. And to quote Jill Duer-Barrick, if everything is important, nothing's important. So through a national consensus convening, we identified 23 high priority gaps that we thought the field might find it valuable to focus on. So what began as a partnership between Casey Family Programs, the Annie E. Casey Foundation, and the William T. Grant Foundation has evolved into a much wider coalition of academic, national, and philanthropic organizations. And that team has been bolstered by extensive participation from individuals with life experience with child welfare from day one. We believe that the new studies in our field really need to address, of course, the most critical issues facing the field. And we also believe that we've got to do a better job of making sure that our research findings are actually used to support innovative policy practice and the changes in funding that we know are so badly needed. Currently, the National Research Agenda Coalition is encouraging federal, state, and local foundations to address these 23 high priority gaps. And we're actively promoting conversations about the following topic areas. I'll be very brief this morning, but basically it's transforming the research community by engaging researchers in how they see their role, with study subjects seen as partners in the research, and also prioritizing a commitment to social justice. We're also trying to promote conversations around the importance of stakeholder involvement, and that stakeholder involvement needs to be funded by funders, not just given lip service. We believe that participation by community leaders and people with lived expertise has to happen in the development of the research agenda, because that lays the groundwork for the kinds of collaborations that are really required to conduct research in today's world in an ethical manner, and we believe in an effective manner. And to that end, some of the cultural experts in the initiative and some people with lived expertise have just produced a DEI tool to help enhance program planning and research study development. It's short, 3 pages with about 9 pages worth of glossary of terms and some helpful background information. We're really excited about it, and the reception we're getting from the field so far has been very, very positive. So we're going to put that on the website in a matter of the next few days. The point here is that these collaborative research approaches can help us ensure that the research meets the needs of the children, the families, the communities, and the provider organizations, not just the researchers. And I think our panel today is really going to exemplify that notion very much so. So what we're trying to do here is improve how research is done, at the same time as getting more research funded to reform child welfare. So it's sort of a two-dimension kind of an emphasis for the initiative right now. For more information, you've all been sent a 5-page overview of the initiative. Nicholas kindly and the team mailed that out to you. And then in a minute, I'm going to put in the chat the link to the website that has, or will have in a few days, the DEI tool, but it has a number of the other products as well. So thank you very much for investing your time today with us. And very much, I want to thank the speakers that have prepared their remarks for today. And I'm going to turn it back to you, Mary.
Thank you, Peter. So it's my turn to turn around and thank you for your leadership, for keeping a very diverse, vibrant coalition of scientists, people with lived experience, partner organizations, funders together. That is not an easy task. So Peter, it's been a real privilege to watch you work as you advanced a really important research agenda. So my job is simple: to welcome this group here today, whether you are joining us on YouTube or live here on the webinar. On behalf of the American Academy of Social Work and Social Welfare, welcome. I want to thank our foundation partners that you will see at the bottom. We've already acknowledged the Annie Casey Foundation, Casey Family Foundation, W.T. Grant Foundation for their support. Stephanie, you are a rock star from the Clark Fox Policy Institute. Thank you so much for lending your skills and expertise. Also on the call today are Nicholas Asher and Sanjan Duat. Without the two of you, this organization would not be possible of this webinar series. And you'll see Sanjan again as we go through the question and answer piece. If you missed the materials sent to you as part of registration, Nicholas in the chat put a link to the 5-page overview of the 21st Century Research Agenda. So feel free to download that. And then we'll also resend to all that registered for the webinar today those materials, because it's so important. The last thing I just want to say is to echo my thanks to our panelists. These panels were intentionally created. An Academy Fellow really helped to broaden the conversation and bring in a set of partners that are related to these particular topics that you see on this the screen. So I'm super excited to hear many voices. And as a best practice, I'm going to turn off my camera. Sanjan and Nicholas will probably, Stephanie, do the same, but we'll be here really listening to your remarks and really grateful for you kicking off this series. The tool that Peter mentioned around how to create collaborative, equitable research. If you're interested in that tool, please note November 7th. That webinar will focus on the developers of the tool and how best to use it. So with that, I think Peter and I have become one person and covered a lot. And so I'll turn it over to our panelists. Thanks so much.
Thanks a lot, Mary and Peter and Stephanie and everyone else for inviting us today to talk about this childcare research partnership. We're really excited to be here. We thought while we're getting the PowerPoint up, it would be useful to have each of us introduce ourselves a little bit more than Stephanie did, just so you could get a sense of who we are and where we come from, because part of the thing about this partnership that we think is unique and important is we come from lots of different backgrounds, and our organizations are all different. So let me say 2 words about me. I'm probably the most obvious and boring of the 4 of us. So I'm a faculty member at the University of Chicago Crown Family School of Social Work Policy and Practice. And I have been doing this childcare related research for many, many years, and have really always had a strong commitment to doing community engaged research. But I think my career has just moved further and further in that direction since I started too many years ago. So that's me, and you'll hear a little bit more from me later. But David, you want to introduce yourself?
Sure. I'm David Alexander. I'm the research director of Illinois Action for Children. Illinois Action for Children is a large childcare organization, early education organization in Illinois. We have state contracts to do a lot of work in Cook County, delivering childcare subsidies, supporting childcare providers in terms of training and grants that ultimately come from the state, providing Head Start and early state pre-K in the Cook County suburbs. And in addition to that, we statewide, we are an advocacy organization, and we support early childhood collaborations throughout the state of Illinois. Thanks. Teresa.
Hi, I'm Teresa Hawley, and I'm at the Center for Early Learning Funding Equity, which is a relatively new center at Northern Illinois University, where we're focused just on how the early childhood system is funded, obviously from our name. But I sort of unique in this partnership is that I started on the state side, and now I'm more on the researcher side of the house. So I was in the governor's office as we created a lot of the initiatives that we're going to be talking about today that the research is being done on. I went to the governor's office from Illinois Action for Children. So we talk about it like the long standing partnerships that we've had here. We've known each other a long time, but again, I'm a developmental psychologist by training, came from the research world, went into very much the policy world, and am now happy to straddle the two at Selfie.
And my name is Sindhu, and I am with the state. And I was previously, though, an educator in a childcare center, and after that switched into the policy advocacy realm and worked a lot with educators around the state before making the move to the state about a year ago-ish. And our goal, is to partner with all of these partners and learn how we can improve our policies and provide any accesses and supports that the researchers need in order to do this work.
Great. So that's us, and we'll hopefully through the course of our presentation, you'll learn more about the kinds of work that we're doing. The next slide just has an outline of our presentation. So I'm going to kick us off and say just a little bit more about the background of how we came to be as a partnership. Then Teresa's going to give some introduction to the issue that kind of drives our partnership. So this childcare dilemma that we really struggle with. And then Sindhu will pick up from there and talk about the Illinois context and what childcare policy looks like in Illinois and where Illinois wants to go. And then David and I will talk about some of the research activities that we're undertaking with our partnership, and we'll end with some lessons learned that we'll all sort of participate in that part of the presentation about how to maybe think through what the challenges and the benefits are of research policy partnerships such as ours, and some lessons learned, some takeaways for if you're interested in developing such a partnership. So if you go ahead and go on to the next slide, there we go. So you just heard about our partnership, who we are. It includes the four of us that you just heard about, but also I want to say we have another partner who represents INCRA, that represents the network of childcare resource and referral agencies for the state. And so in addition to our four organizations, 2 universities, the state, and a large childcare resource and referral agency in Cook County, we also have the network of childcare resource and referral organizations for the state involved in our partnership as well. Our partnership is currently being funded by a federal initiative through the Administration for Children and Families. And this is a really cool initiative. And David and I have been part of, this is, I think, the 4th of these partnerships that we've been part of funded through ACF. So I want to make sure people know about them, the researchers and the policy and practitioners in the audience. So with this particular federal initiative, ACF funded 9 cooperative agreements, so 9 different partnerships across the country with states and tribal communities. And in addition to the work that we do in Illinois with our partnership, we also meet monthly with the other 8 partnerships and talk about, collaborative questions that can inform hopefully national policy, not just our own state policy. So it's an interesting kind of structure that I think is potentially really, really useful. And I actually think I've seen kind of bear fruit over the years. Okay, next slide. So that's the title of our partnership. So let me just say a little bit about us. I feel like this is a little redundant, but we've all been in the childcare field for many, many years in, as you heard, different policy, administrative, advocacy, and research roles. And we have really long-standing relationships. I think David introduced himself to me once close to 20 years ago. I was presenting at a conference and he, walked up to me and we had a conversation and we started doing research together. Teresa and I were actually in graduate school together, but that was just totally coincidental. And David and Teresa, as you heard, worked at the same organization for many years, and all of us are sort of in the same, it's a little incestuous community, this childcare world in Illinois. But I think for good, I think we really, those longstanding relationships that come from very different parts of our lives and different parts of the context, I think actually help us work together in interesting ways. There's, I would say, 4 things I want to say about factors that I think have really spawned the current partnership. First of all, I think we all had kind of a shared frustration with these ongoing difficulties moving the childcare field to a place that served the needs of the most disadvantaged and precarious families, that also supported the childcare infrastructure and the workforce that provides childcare to those families, and that meets both the needs of children, sort of children's developmental needs, as well as the needs of their parents and caregivers. So we've tried over the years many different initiatives, and there was this sort of shared frustration that things just weren't moving the way we would like them to. We also, I think, our partnership came together because there were really some pretty clear knowledge gaps about how to move the work forward. And we were starting to have some breakthroughs, I think, in what might work, but still some gaps about testing what might work. And so that, I think that need, the research gap, was really one of the factors that sort of led us to the partnership. And then the last 2 things I think are really important. We have a governor who is super interested and energized in committed to investing in early childhood policy. And so we have this new energy, we have new funding, and we have a real political commitment, I think, in Illinois to do interesting things. And Cindy will talk a bit about that later in our project. So the one caveat I'll leave you with before we go to the next slide is that, as is probably clear, we are not a child welfare partnership. And I know, and through Peter's remarks, it's clear that the background of the 21st Century Report is around child welfare and child protective services. I still think, though, first of all, I thank you for inviting us, even though that's not who we are. But I think that the broader childcare context is really important, and hopefully can speak to some of your goals in the 21st Century Report, especially those based on community-based prevention goals. But I think even some of the other goals throughout that are sort of throughout the 23 that I read in the report. Okay, so Teresa's gonna now talk to us about what we're calling the childcare policy dilemma.
All right. So what is the state trying to do when it funds or provides funding into the childcare space? It's trying to make sure that there is equitable access to care and education services for our youngest children. And so it's got to function in a lot of different ways. It needs to be the work support for parents, meaning it's got to be able to provide care for children all the hours that their parents aren't able to provide that care for the kids themselves. So for a lot of families, that might mean odd hour care. It might mean 9 to 5 Monday through Friday care. Lots of different types of care that families need to have. It needs to be a system that is attentive to the developmental needs of young children. So it's got to be setting up safe and healthy environments for kids, for sure, but also ones in which they're going to get the kind of one-on-one interactions with adults that support healthy brain development, support the emotional, social, and cognitive development and physical development of those kids. And lastly, it's got to be a system that actually works for the people who work in it and the people who are the investors in it. It's a largely for-profit system, childcare in our country. So providers need to be able to break even and to make a profit if that's what they're up to, especially home-based providers, because that profit actually is their salary that they make out of all this. And it needs to be a good job. It has to provide decent wages and benefits and all those sorts of things. I can say pretty clearly that our early child and education system is failing on all of these marks. And that's why government is in the job of trying to intervene to make it better. Why is it failing? Why is it all so difficult? Well, first of all, it's very expensive. Providing care to young children is labor intensive. It requires a lot of staffing, and it's very expensive. So parents are often not able to afford what it is that they need in terms of a service for their kids and families. We know that the program quality that's out there, because programs are threadbare and understaffed and maybe not emphasizing the kind of curriculum and development, all those kind of things that kids and families need, the quality is not what we want it to be. And for providers, we know that they're suffering from low wages. They're not getting the stability in the field. They very often don't get any kind of benefits. They don't even get paid time off. And the program directors are left with struggling week to week, wondering whether they're going to be able to meet payroll, whether they're going to be able to provide for their staff and keep their program open and going. It's a very, very precarious business out there. Again, why is this? Well, because the work of developing young children and investing in their growth and development is labor-intensive work. The expenses for a child care program are often 60 to 80% personnel, which is on the very, very, very high side of an industry in terms of how much the cost of the going just towards personnel. And that's true even with the low wages that folks are being paid in this field. So if we were paying folks the right kind of compensation, you're going to be more up on that 80% of the cost. The physical infrastructure adds cost to this, especially if it's outside of a home. There's all sorts of classroom expensive administrative services, all that kind of stuff. It really just does cost a lot of money. And it's easy to think about why that is. If you think about how many babies can one person really safely take care of? Maybe they can take care of 3 or 4, maybe 5 if the kids are toddling around, right? But if there's a fire in the building, they can only carry so many kids out. You really do have to have a lot of staff there taking care of those children. And if you just take that one person's salary, if they make a decent amount of money and you're only able to divide it by 4, and then know that that salary is only part of the cost, there's also the director, the administrative services, the rent, all that. It is just a very expensive thing. It's unaffordable for families, and you can't really reduce the cost without hurting the development of the kids. So we're left with this system where, because it is a market-based system, providers are setting their prices that they charge in this system where they believe parents are going to be able to pay. This means that there's a lot more childcare available in places where parents can pay in higher communities, and a lot less childcare available in communities where parents are not able to pay. Got this little chart here, the actual cost of delivering high quality is way up here. Providers are maybe able to set their price here in a really mixed income or high income area. Most families can only afford a price that's maybe around here, and the poorest families can only afford a price that would be way down here. And so we know there's an affordability crisis in childcare across the country. And families are at their lowest income earning time of their lives when they have children. So it's a compelling case for substantial public investment. Well, how do we make that public investment? You kind of have a couple of choices here. You can invest on the demand side, or you can invest on the supply side. Almost all of our strategies so far have been on the demand side of subsidizing families so that they can purchase their care in the private market. So this is our the Child Care Development Fund. Most of that goes into child care vouchers, which are based on the idea that care exists out there in the community, and what the government needs to do is to give parents the dollars to be able to buy into the market the same way middle and upper income families are able to buy into the market. Part of the problem with that is that middle and higher income families are not able to buy into the market that we would like them to be at, because they're not able, even they are not able to pay these high prices. On the supply side, you could invest in the supply so that you're buffering that cost for everyone, and you're able to make sure that you're able to raise that cost more towards that high cost of quality, even though most parents wouldn't be able to pay that. Why can you not just do it on the demand side? Because the subsidized enrollment is kind of all over the place, and it's only a fraction of what the provider revenue is going to be. A very small minority of providers have a majority of their kids on subsidy. Usually it's this ever-changing mix of whether kids are on subsidy or they're on the private pay. And so if you raise the subsidy rate, you might have this unintended consequence of the provider having to raise the private pay rate as well, because otherwise they're going to have an uneven balance of revenue across the children who are participating in that. Also, when you invest on the demand side with these vouchers, you're really sort of just giving money to be able to purchase the service. There's very few strings attached to that, other than the basic health and safety regulations that might be part of licensing in the system. If you give those higher subsidies in the hope that that's going to translate into better wages, better staffing patterns for the program, you don't know that that's going to happen. In fact, providers may decide to take that additional revenue that you're giving them in the form of profit. And even if the ones who are in the industry right now don't decide to take it as profit, it will be a big old magnet for people who would like to take that as profit to come into the industry and to set up these programs. And if you're not able to tie any of those strings. So when you look at supply side investments, you might be able to tie some more requirements to that, to give resources into the industry that are going to produce what you want to produce: adequate teacher compensation, better ratios, better professional development for the staff that are working in the field. So this little graphic here is showing, like, if you think about these little boxes as the payment for each individual kid, that kid's tuition payment, it might come from private pay, it might come from subsidy. Just growing the size of these yellow boxes isn't going to do the trick of getting the total amount of money that people need up to the true cost of quality of care, because it's going to put pressure on the blue boxes getting bigger, which means making it more unaffordable for more families. And it's just going to be unstable for the provider. So what we're talking about is stable base of revenue for providers as a supply side investment in the childcare industry, with strings attached that help you get to better teacher compensation, better ratios, better professional development. So that's a whirlwind tour of the economics of the childcare industry and how the state might be thinking about investing in it differently than it has before. I'm going to turn it over to Sinthu now, who's going to talk about what the state is actually trying to do.
Thank you, Teresa. We can go to the next slide.
I
What?
don't hear you.
Oh, can others hear me? Okay, great. Okay, so while recent policy initiatives in Illinois utilize both the demand side approach through the Child Care Assistance Program and the supply side approach through grants and contracts to providers, we're going to focus, at least I am, for the purposes of our presentation and due to the problems Teresa mentioned about the demand side only approach, I'm going to focus on the second one. But first, we're going to take a step back and provide some context. The CCAP program, funded through federal CCDBG and state general revenue dollars, gives vouchers to eligible families with family co-payments based on income and family size. Grants and contracts to providers have had a relatively limited use prior to the COVID-19 pandemic in Illinois. There was an increase in grants to childcare providers to stabilize revenue during the pandemic when enrollment was down. And Teresa, we can go to the next slide. Thank you. For some additional context, in February 2023, Illinois Governor Pritzker announced Smart Start Childcare, a component of Smart Start Illinois, an initiative to help Illinois become the best state in the nation to raise young children. The full program includes efforts to eliminate childcare deserts, increase funding to childcare providers, and investment in. This is intended to reach more families with early support. Then in October 2023, Governor Pritzker announced a proposal to create a unified early childhood state agency. And in June 2024, he signed SB 1, creating the Illinois Department of Early Childhood, a unified state agency that will focus on the early childhood programs and services for young children that are currently across 3 different agencies. This will improve equity and accessibility for families and caregivers by addressing the unnecessary burden of navigating the current complex and inefficient system. Smart Start Childcare is one of the 3 components of Smart Start Illinois under the Illinois Department of Human Services Division of Early Childhood, and includes Smart Start Workforce Grants, which will provide funding for childcare staffing wage increases starting this October. Next year, we hope to expand the Smart Start Quality Support Program, which is currently in a pilot form, and that provides funding for staff wage increases based on credentials, improving staffing patterns, and offers activities to support continuous quality improvement. And so these really get to those types of changes that Teresa spoke about, which can be achieved with that higher amounts of funding. Since the Smart Start Quality Support Program is in a pilot phase, while the remainder of Smart Start Childcare is still being developed and rolled out, we'll use Smart Start Quality Support Program as an example of how we aim for this research partnership to look like. The Smart Start Quality Support Program began as a pilot in 2020 and was designed to test a contract funding method, providing additional supports for continuous quality improvement and new standards. The pilot was focused in a rural region of Illinois and required participating programs to have at least 40% of their enrolled children participating in CCAP. We have 34 programs, one of which has 2 different centers currently participating in the program. And the pilot gives childcare programs the resources to invest in staffing and other quality supports, which is different from our traditional quality funding that is given to childcare programs after achieving quality. We hope by providing these resources, we're able to reduce staff turnover, support staff in achieving higher credentials, and allow programs to engage in continuous quality improvement, all of which will lead to greater access to higher quality childcare for children and families. We spent our state fiscal year 2024 designing Smart Start workforce grants, which are rolling out this October. And with the start of our state fiscal year 2025 in July 2024, have been transitioning to designing the expanded Smart Start quality supports. And since it's being expanded from a pilot, this research partnerships, research activities are helping guide the design. And this is seen in this first box of the lessons learned from the Accelerate Childcare Center pilot. I'll turn it over to Julie to share more about the research activities before share about how those get to impact policy design.
Great. I'm going to share my screen now. Hopefully this will work. All righty. Okay, sorry, I have to move something's funny with my notes. Hold on, sorry. I can just move it this way. That works. Okay. So our research activities are targeted at evaluating policies from both the demand and the supply side. But as Sindhu said, much of what we're going to talk about today is the supply side initiatives that Illinois is undergoing, because they are kind of more innovative than the demand side approaches, which are important, but I would say more traditional and we argue insufficient to really moving the needle on childcare. So on the demand side,
Julie, excuse me, Julie, is there a way to increase the size of the screen?
Oh, can you not see it?
It's smaller.
Can you see that?
Yes, thank you.
Is that better? Sorry about that. So on the demand side, we're examining two components of the state's childcare subsidy program: the CCAP vouchers, which, as Teresa said, subsidize the cost of private market childcare with the goal of making childcare more affordable to working families who are eligible. And our payment rate study looks at whether historical increases in the rate that providers get reimbursed actually does result in increased childcare capacity and supply. In other words, how much does just moving the generosity of the voucher change supply of childcare? Co-payments on the demand side refer to how much parents are required to pay on top of the voucher that the state uses to reimburse providers. And in our co-payment study, we're looking at equity in co-payment rates across income and family size over time, with a particular focus on the most recent co-payment change in Illinois, which caps the co-payment that basically now in Illinois, the most any family on subsidy has to pay is 7% of their family income, which finally aligns with federal standards. And it virtually eliminates the co-payment for the families with the lowest incomes. So our partnership will be looking at both of those components, but as I suggested, we're really especially interested in the supply side pieces of this. So we're conducting several studies to inform these initiatives, and this is really where we'll then focus the rest of our presentation today. So let me say something about these first two activities that I've circled here. We're doing an ethnographic examination of the Smart Start planning process that Sindhu alluded to. And we're doing an evaluation of that Smart Start quality support pilot that she talked about. And I'm going to say more, especially about that in a minute. For the embedded ethnography, though, one of the cool things about this partnership, I think, is our ability to really observe the planning process over time through reviewing policy documents that we might not otherwise get our hands on, through interviews with policy stakeholders and providers involved in the process, and by attending planning and implementation meetings of the state's child care advisory group. The ethnography asked 3 questions. What factors shape program design and rollout? How do plans shift over time, the state's plans, and why? And how are equity goals manifest in the design implementation? So that's the ethnography. I'm not going to say much more about that. The pilot evaluation is an effort that I will say more about. Sorry, I'm having a little trouble with my screen here. Here we go. The argument here is we want to understand for the pilot evaluation how directors have experienced each component of the pilot, whether the pilot has ultimately improved recruitment, retention, and workforce quality, and then what recommendations might we draw from our pilot evaluation to help inform the state as they scale up the evaluation, scale up the pilot to a statewide program. So let me tell you a little bit about our pilot evaluation. First of all, the theory of change that guides the pilot evaluation is something like the following. If we don't take just vouchers, but we do a vouchers plus model, that is, we decouple demand-side vouchers from supply-side investments, do we see that enhanced payments to providers that are conditional on certain behaviors, right? So it's not just money for money's sake, but money that directly goes to wage enhancements, directly goes to quality investments. By doing that, are we able to deliver workforce gains, program quality improvements, as well as increased access to high quality care? So what have we found in this evaluation? First of all, grants directly to programs, which are required to actually be used for these different activities, do indeed elevate staff wages. They also seem to incentivize training. They led to increased staffing, and they, from the perception at least of the providers, they improved recruitment and retention. That being, and I would say some quantitative findings, these are all based on provider interviews. Quantitative findings from some other research also seems to confirm these director perceptions. Even though these are positive results, it's important to say that the funding still was insufficient from the perspective of the providers to address some serious competition challenges, even from fast food industry and other kinds of what we think of as low-wage jobs. So even with the sort of enhanced salary, providers are still having trouble keeping providers in the childcare industry. There's also, this could be a discussion on its own. There were also several sort of complex and burdensome reporting requirements to be part of the contract that made it difficult for providers sometimes to participate. The pilot involved monthly coaching sessions. These were one-on-one coaching sessions with providers with a very experienced and much beloved coach. And providers loved these coaching sessions and found them to be probably the most useful part of the pilot, other than the money that they got to support salary enhancement. There were also monthly community of practice meetings. These were like support groups with the 34 directors, childcare center directors. And they were an opportunity for directors to share best practices, to just kind of kvetch with each other about what's happening in their programs. And people also really liked these. They did seem to think that if they had to trade one for the other, they would prefer the coaching sessions because they felt more clearly useful and moving to a next step. The support community of practice, they enjoyed, but they also they faced time constraints that sometimes made it difficult for them to participate. The third part of a third part of the quality investments involved these continuous quality improvement activities that that programs, teaching staff and providers were engaged in. And these had a more mixed reception. About 50% of the programs felt that the continuous quality improvement activities beyond the monthly coaching and community of practice were useful. But many people found them difficult. Some liked the reflective supervision that was involved with these classes, with this piece of it. Others felt like it was just too hard to get teachers in the same room, that they were short-staffed, that there was high turnover, and adding this extra layer of continuous meeting together to plan and do and review their everyday activities was too much given the constraints of often very long and constrained workday. Finally, I'll leave you with the importance that all the directors put on ongoing technical assistance that they said was absolutely necessary for them to participate in the pilot. And they were grateful for the coach and also the program administrator, and saw that they were both really successful. They were important for the success of the pilot. And scaling up the program, they argued it would be really important to have this kind of ongoing technical support in the same way. So I'm going to move on now and say, from what we've learned from the pilot, we're now helping to inform the two key initiatives of the state, the workforce grants that are just starting, and then the scaling up of the quality support grants. So I'm going to just quickly say what we're doing, one part of what we're doing, and then David's going to talk about the second part of what we're doing here with the workforce grants and the quality support grants. So our goal here is really to understand how are providers understanding and experiencing these two programs once they actually happen. They haven't happened yet. How do the providers' experience change over time with these two initiatives? And do they achieve, from the perspective of the providers, the expected outputs and outcomes? And so we're conducting 3 waves of surveys statewide with childcare centers and family childcare homes participating in the Smart Start Workforce Grants and the Smart Start Quality Improvement Grants. We're in the field right now with the baseline data, and we'll do 2 waves with these same people in the next 3 years. In between the waves of the survey, we'll do in-depth interviews with a subsample of providers to try to learn more from their perspective in a more qualitative and nuanced way, how the initiatives are working and whether they're meeting their expected outputs and ultimately outcomes. It says here that the interviews are with 15 or 20 providers. We're actually we'll probably move that up a little bit and have it more like 25 providers each time. Okay, so David, you want to talk about the outcome evaluation?
Sure, thanks, Julie. I'm sure everyone, there's been a lot presented to you already. So I'll go pretty quickly through these 3 slides. The challenge for us is to, in this part of the research, is to use data that the state collects, that is, its administrative data, to analyze the impact of these new grants on equitable access. And as you know, as we've seen so far, equitable access involves affordability, it affords capacity. All childcare markets are local, so this has to be disaggregated across geographies. And quality, again, is a major issue, and measuring quality, understanding the impacts on quality will be important as well. So what are we going to do with our administrative data? Well, first we'll want to look at affordability, and we have a number of measures of affordability for childcare that we'll be looking at, beginning with price and then thinking about price compared to family income. And then we're also interested in the impact of these new grants on providers. As you've heard, that a number of providers do not rely heavily or even allow any subsidized families in their programs. So one of the questions we have is, will providers increase their services to subsidized families as a result of these new grants that allow them to pay their workforce more and to improve their quality? So that's on the family side. On the again, on the program side, we'll be looking at administrative data. Hopefully that these data will be good. That the state is collecting on wages and salaries in programs. We'll be interested in staffing levels and whether the higher compensation does help with recruitment of new staff and retain current staff in the programs. We have a number of measures based upon the administrative data that we'll use for that analysis. And then finally, quality of care, the impact of these new grants on quality of care. The state has a quality rating program, and so we're going to be using those measures of quality, as well as, Teresa pointed out how important the staff to child ratios are. So we'll be looking at whether the ratios improve in programs and in classrooms across Illinois. And again, the equity side of it is we're going to be comparing by race, by ethnicity, by region, rural versus urban region, poor neighborhoods versus not less poor neighborhoods. We'll be doing a lot of those comparisons to analyze the impacts of all of these measures in an equitable way. So what are we doing? This past year was year one. We've designed what we thought would be a description of the data that the state would need to collect to the new data, on top of its current data, the new data the state would need to collect to adequately support an evaluation. And I should point out that the cooperation with the state is absolutely essential. We couldn't do any of this data analysis without a long-standing partnership and an interest from the part of the state of Illinois, as well as trust in the researchers and our capacity to do this work in a responsible way. And anyway, so we spent first year thinking about the quality of the data we needed and the data we need, and then in the fourth year we'll be doing the analysis. So we'll have 2 years of the quality grants and 3 years of the compensation grants, where we can look at the impacts and the trends. To do that, we'll be linking several administrative databases and using census data to do that work. Okay, thanks. Now we're shifting gears. We're turning away from the research itself, and we're trying to reflect on our partnership. This was we understood this was an interest of the audience, and so we thought we would each take a turn at thinking about the benefits of our experience, our work, the challenges, and some of the takeaways for developing partnerships for those of you who are thinking about it or have tried partnerships that aren't working or whatever. First, I should emphasize what I think Julie said at the very beginning. This is a team that we know each other pretty well. We understand each other's capacities, talents. We understand each other's institutional constraints. And I think we also understand the childcare system in Illinois very well. We understand where there are gaps in services, gaps in equity, where there are gaps in data, across the system. So there's a variety of we come pretty prepared for this. And this may not be a model for a startup partnership if that's the place where you are or where you are thinking. But so for the benefits from our experience, I'll start with some of them that work for me. Let me look at my list here. I think diversity, we give a lot of lip service to diversity in our culture, but I think we do come from different places. We all have different perspectives on the childcare system in Illinois, about what it needs. We have different perspectives on research, on the best research methods to use. Though I think we have a lot of agreement, but we certainly come from different places in terms of research, in terms of policy formation, what policy can do or can't do. I think we have some differences in experience. So we keep each other on our toes, I think, is the way to think about it. And we should really sharpen each other a lot. And so I think it's useful to look for at least some diversity in perspective in a partnership. Another thing is that it helps develop talent in the field. We have young researchers at Illinois Action for Children who really benefit from hearing discussions, about academic research. It helps them go back to their classrooms, and it helps to think about policy and to see policy discussed by policymakers and policy advocates, people who really know the grubby details of the field. That's really useful to learn. Another benefit, I think, from us, I'll stop here, for benefits at least, is that we already constituted as a partnership. So when a funding opportunity arises, we're ready. We don't have to stop and think up new ideas. We already have lots of ideas. We don't have to stop and ask, well, who belongs in this partnership? We pretty much know the field and we're already talking to each other. So that's useful as well. It gives us a kind of leg up in applying for the funding. Challenges, well, you can see that we come from different institutional backgrounds, so we really march to different drums. Our calendars are different. Some of us work to an academic calendar, some of us work to a legislative calendar or fiscal year calendar. And so the pace of our work individually or on different sides, the work picks up or slows down. And the partnership has to be able to accommodate that. It has to understand that. And there are ways, I think, probably ways of doing that. And I think we've stumbled on some ourselves. But that's a challenge that any partnership would have to work on. Let's see, I think I have another one here. Oh, another one I think is just trust around funding. There's never enough funding, and so there has to be a lot of negotiation in terms of applying for a grant, who's going to get what. And I think you have to respect, we have to learn to respect each other's needs for funding. I'll leave it at that. Have respect for our respective needs. Thanks very much. I think I'll pass this on to Teresa, right?
Yeah, Teresa, I'm going to stop sharing because I think people can see your face, and we're just going through like the benefits, challenges, and takeaways that we all perceive as partners.
Yeah, that sounds good. Yeah, so from my perspective, and again, I'll speak more from when I was in the state, because I think that's important. It's that the gravitas of this kind of formal research, what that can lend to a novel initiative like this, it's so important being able to say that we're partnered with the University of Chicago to really look at how this is going and to the governor and say, here are some takeaways that we have from real research on the work that we're doing, is important for being able to move initiatives like this forward. And even the Julie's put up this is our logic model, like laying it out. The skills of doing that researchers have and that policymakers, generally speaking, do not. It's so helpful to be able to lay that out for people and to say, we're doing this and hoping to see this and hoping to have this ultimate benefit is very helpful. David talked about the diversity of perspectives. Social work, labor economics, developmental psychology, early education, like we got very different viewpoints on this on this team, and it really does make the research so much richer. I'll mention one challenge that I don't know if anybody else will mention, but that it's hard to sustain this stuff across changes in state administrations. When you're partnering with the state, we talk about how long standing this partnership has been. And yeah, we've had some points where the funding or the easy access to data, the state's participation in the partnership maybe wasn't the same under some administrations as it is with others. And so figuring out how you sustain that partnership, even in those years when you may not have the funding, you may not have the real estate partner at the table, it's key, because things come back around and you're able to start up the work again. I think that's what we've learned in this whole process, is that building that long-standing partnerships over time is really key.
So I would add first that I agree with everything that David and Teresa said, and I like to hear that research is useful for policy, that research from the academy is useful to policymakers. So that's nice to hear. I mean, what I like about being part of these partnerships is that I'm trying to answer research questions that are relevant and that may actually matter for policymakers and for the people, importantly, who are served by them. And so to me, that's like the cream. That's what's most exciting and the biggest benefit. But I also think the findings end up being useful, not just for policymakers and the people that serve them, but also for informing the broader knowledge base about these issues. So I think this is good for the academy, just as it's good for policy. And I think sometimes we don't think of it that way. So I want to really push that I think we know more as a field, as an academic field, when we understand what's happening on the ground and the messiness and the complexity and the politics and the sort of just the all the stuff that some researchers try to get out of their 2x2 design so that they can see the pure effect. I think what's really interesting about this kind of work is we don't want the pure effect. We want to understand the complexity. And so I think that I like that part, and I think it's really good for the academy in my own view. Selfishly, I think the partnership gives me access to data that I wouldn't otherwise have access to. And also, as David suggested in his discussion of the administrative data analysis, what's really cool about this partnership is we've actually had a say on what kind of data the state is collecting from participants, and so program participants. So that's been really, really great. Some of the challenges, I don't have too much to add with what's been said. I do want to reinforce that policy works at a different speed with a lot of fits and starts, and this makes planning really hard. And so when I look back to the proposal that we wrote and what we actually do, there's often a sort of disconnect. And so ACF, the Administration for Children and Families, has been really good with all the partners at all the partnerships about recognizing that, but that is a challenge. And if a funder isn't used to funding this kind of work, they may not understand that, and they may need some education. You know, I said policy works at different speeds. Academics tend to be slow and plodding, or at least I am, and policymakers work very fast. And so that's just something to keep in mind. I find sometimes a frustration that I don't know, like I thought I knew what was going on at the policy side, but then I hear something else. And so I'm not sitting at all the same tables. I'm sitting at more tables than I would be if I wasn't in the partnership, but I still miss a lot. And so that can be a frustration. And I think our partnership has figured out ways to improve on that by we meet monthly, and at the start of every monthly meeting, Sindhu does a policy update and tells us, you know, what's happening at those tables that we're not part of. I mean, she can't tell us everything, obviously, but she can tell us some of those things. So that's useful. I guess I'll stop there. I do want to say something about tips for building a partnership, but maybe I'll wait till the end there and let Sindhu say a bit about benefits and challenges.
That sounds good. I agree with most of what you all have said, but adding sort of from my lens and perspective, it's really unbelievably helpful for the state's capacity to have this partnership in existence and working the way that it does. It is not possible for the state to do this work. And so in order to ensure that we utilize our resources the best that we can, this partnership serves as that check, right? To ensure that the direction that the state moves in is actually helpful and not just throwing money into the air for no reason. It answers questions to strengthen the program and the policy design. And I really love and appreciate that when things do pop up in those internal planning and design meetings, we're able to take it to the researchers and tell them that, look, this is a priority as part of the program, and trust their brains and work to help us figure it out. And also, as a note, while we participate in a lot of these meetings and the research, the degree of separation that does still somewhat exist from it being different organizations and humans who are doing this research and the data, it helps that exists. It's not like the state is implementing a program and then also analyzing that data to see if it works, there's a bit of a checks and balances there, right? And so that is also immensely helpful. There are challenges, and I don't think it is possible to over-reiterate the timeline issues. And so I want to add to Julie's reiteration of David's point there. This is a 4-year research grant, right? And it is taking place with an original intent that was written before some of these programs were properly designed and fully conceptualized. And so a lot of things change in that. And we are working at different paces in that, we will have the opportunity as the research continues to make improvements and be able to incorporate it into our program design in the future years. But sometimes we want answers now, and we're doing some part of this, expansion right now. And it's that tug of how much do we have so far that we can still incorporate now and be able to move with the opportunities, whether policy wise or otherwise, when there is an opportunity to make changes and improvements. I would also add, while Julie, you noted that the access to data is a benefit for you all, it still feels like just the existence of the data usability and getting you guys that access can sometimes remain a challenge. It feels like it takes a year to create a data sharing agreement that then lasts for 2 years. And so it's a lot of, those long bureaucracy processes that you have to work through when you're working with so many institutions and the government all at once. But overall, when we work through those challenges, the ability that it has to improve our state's policies and program design is remarkable.
On that last point, I would just say that there are other models that institutionalized data sharing agreements. And I'm thinking about the Institute for Research on Poverty at University of Wisconsin. It's the University of Wisconsin and the state of Wisconsin has a standing data sharing agreement, which people on the call probably, some people probably know about it. And so they don't have to, as I understand it, write up a new data sharing agreement every time. And so I think, and you guys kind of have that with Illinois Action for Children, right? And so there are ways to institutionalize these kind of beyond the partnership itself that I think is that's something that's worth other states thinking through, and or if it's a local thing, other local communities thinking through. I'll just end, and then I think we should open it up by summarizing some tips for building a partnership that we came up with just very quickly. This is really a list, so it's not there's more that one could say, but we came up with, I guess, 7 or 8 different things. So first of all, I think, David talked about this as well, but it's really important that we treat, as you think about building a partnership, think about the respect that's necessary to give to the different people in the partnership, and to recognize the strengths that each person in each organization brings and the skill set they bring. It's also in next tip 2 is to recognize that partnerships take a long time to build. This particular one didn't take so long, but that's because we were building off of past partnerships. And the first one, actually, David, I still remember that 2010, 2011 partnership, which was slightly different composition than this, but it took 18 months just to get the first data sharing agreement. I mean, everything took a long time in that one. So that just, you have to recognize that things take time to build. I would suggest that it makes sense to really get buy-in from institutional authorities, not just individuals. And this is something I've really had to learn, because I think, oh yeah, we're all on board. And then I find out from our university research office that, oh, we can't do it that way or something. So you've got to get the institutional buy-in as well as the individual buy-in. I think it's something that was really clear that ACF wanted before they would fund anything is to demonstrate that your partners work together from the beginning, even from the inception of the proposal. So we're not just working on dissemination of findings together, we're working on what is the research question from the beginning. So that itself is a partnership piece of work that the partnership does. What is it that we want to study? What makes sense? And so that collaboration has to start from the beginning and then kind of continue throughout the design and carrying out and dissemination, writing and dissemination of the research, which doesn't mean that we don't do independent papers and briefs and things. We do, and we also do collaborative ones. Create clear expectations and standards for participation. In other words, be really clear about whose role is what and who's doing it. I think that's just good practice and leads to fewer surprises. I think it's important to be realistic and also flexible as you develop your partnerships. And as I suggested, to try to institutionalize them so you don't have to start over from scratch every time. And then finally, to have fun while you're doing it. It's always good to, have a Saturday afternoon backyard. It doesn't happen enough, but it happens occasionally, get together. And I think that those kinds of relationships, these kinds of relationships can be really nourishing in all sorts of ways, not just because we're getting policy done, but getting policy done is important as well. So I think that's the last slide. Does anyone have anything else to add before we go to Q&A?
Thank you. Thank you, Julia, Sindhu, Teresa, David. That was extremely rich in terms of not just the work, but the learnings, and both your energy from working together and the synergy you found really came across, even despite all the complexity of the work that you're doing. I have a couple of questions. I will read them both out before, anyone on the panel can take them, or all of you can. They both have to do with the reproducibility of the work. I know you're at the beginning of, even though you've been working together for a while, you're at the beginning of this project. About the first question is from Dominica Miramo. It says, should this program be successful, would this partnership be interested in piloting in other states? If so, how would you go about this? Victoria Babicheva had a question that goes, how do you ensure reproducibility by meshing together the political implementation and the research methods? If another state was to try and accomplish something similar, there would have to be a lot of modification. Do any of you have any expressed interest or communication with other states already?
I mean, this is interesting because this partnership is being funded by a federal initiative that I mentioned really briefly at the beginning. So there are 9 partners that meet monthly, and I'm kind of smiling about the question because there's been this tension across the 9 projects. We're not all doing exactly the same thing, but we're all doing work on payment practices, broadly speaking, in childcare. That was what the RFP was on. And the federal government is pushing really hard for us to not just share research questions, but to to identify measures that we all use, data methods that we all use, analysis strategies that we all use, to try to be as sort of uniform as possible across the 9 projects. And there's a lot of pushback from not just from us. In fact, I think we're a little bit more willing to try to do that than some others. But I mean, I think there's pushback across all the. It's not because in a perfect world we wouldn't all do that, but there's sort of a, I think, misperception sometimes that if we're all doing the same thing, it'll produce the same results, or it'll be as good. I mean, I guess that's the thing. It'll have the same positive or negative effects everywhere, but so much of what works is context dependent, right? And so I think some of the pushback that the federal government is getting on this is, but wait, a tribal community is very different than the state of Illinois as a state, and the state of Illinois is very different than Virginia. And so we need to have both some recognition of what makes sense to share, and also an understanding in our designs that there needs to be enough context that's measured and taken into account in order to understand what's really best for any particular place. I don't know if others. Teresa, you were at that meeting in DC where this became quite.
Yeah, no, well, and it's interesting because I think there's that from the policymaker's perspective, right? You want to be able to understand, am I doing a better job than Virginia, right? Or is, or what is that I should be learning from so that I can do it as well, especially in this work that we're trying to do in Illinois, where we're new way of investing, this whole supply side of investing. Unfortunately, we're like the odd man out within this research collaborative, and they're focusing much, the other 8 projects are much more focused on the demand side. It's just the more traditional way that we've invested in this industry. But I do think it's this network of partnerships rather than trying to take your partnership on the road. David talked about how deeply everyone here understands Illinois' system. And I would say in my new position at Northern Illinois University, we do work with other states. And what we learned is like, holy cow, the learning curve in each state about how they do childcare is very steep. And so I don't think you really can take this kind of partnership on the road. It's about building it where you are, and then maybe making that network across partnerships.
Thank you.
But I think for the partnerships as well as for the research, there are principles that can be taken on the road, right? So they're like principles of good research that can be paid attention to, and there are principles of collaboration that can be paid attention to. And similarly with the research itself, I think while what a supply side investment might look like in Virginia, I don't know why we're picking on Virginia, but Virginia might look different than Illinois. I think there's probably something universal that we can learn, that, supply side investments are good at this, but not as good as that. And demand side if what you're trying to do is get parents to have more control over the choices they make in the market, a demand side voucher might help you do that. But one thing we're thinking is that you might give parents more control over choosing their childcare provider with a voucher if you've brought up the system from the supply side. So are they complementary, right? And so there's sort of, I think basic social science and basic theory can help us predict what might happen, but the actual way in which you mix it all up and implement it is going to look different in any particular place, I think.
So there is another question which relates more to implementing the research funding partnership at more of a local, county, or regional level within Illinois. Are there any unique opportunities, challenges, or recommendations for that your team may have?
So we do some work with the city of Chicago and working on that more local level and helping support them. What I would say it's different at the local level is that they have even fewer resources. Sindhu talked a lot about how few resources the state has to be able to do research, manage its data, think about these analyses, all that kind of stuff. And when you get down to the local level, they have even less. So you have more interaction with the people who are very on the ground trying to make the programs happen. That's great. But you as the research partner have to bring a lot more to the party in terms of infrastructure and even being able to collect or organize the data. And David, I know Illinois Action for Children does a lot with community-based. You probably have had similar experiences.
Right, but they're not with research partnerships like this. There are other forms of partnerships really, where the people bring us a question or a problem, and we try to give them an answer. Julie and I have worked with other childcare resource and referral agencies in Illinois on other research projects, and that's always been very positive. We find people really interested in the research, and really they seem to enjoy the participation. So I think that's always good. The question is how do you fund that? I think, and that hasn't been our focus. We'll focus. Our research we're going to be doing a lot of geographical analysis, so we'll be even looking at individual addresses and where their childcare providers are, where their childcare opportunities are. But that it's different from working with a county or a level, or a childcare resource and referral agency at a county level.
Sanjam, I noticed the question about, are we just focused on providers? And it's a great question. And I thought about saying something about earlier, and I didn't. This project is very provider focused, although David's administrative data is going way beyond providers. But in terms of the people we're talking to policy stakeholders of various sorts, so advocates, et cetera, and also providers who themselves are often advocates. But we're not bringing in families that much in this particular project, because so much of the focus is on the payment rate structure. It's a slightly different question than some of our other studies, but in a lot of our other work, we've done work on, like, David and I did a lot of work on why is there so much instability in the childcare subsidy system? In other words, why do families stay on for such a short time and then fall off again? And that project was largely, there weren't very many providers involved in that project. That was mostly focused on kind of different surveys, qualitative data, and administrative data on families that we focused on for that. So it kind of depends on the research question, but this study is very program and provider focused, I would say.
Thank you. I was going to ask, I know you mentioned some learnings and some elements that you think really make this partnership successful, and one of them was time. And we were wondering, for emerging researchers, what do you have any suggestions for them if they're interested in collaborative methods and building relationships with community partners?
Are you thinking specifically around like worrying about a tenure clock? And you said emerging researchers, so I'm wondering if you're one, because there is that question. There's sort of this question of, I have 6 years, maybe 7 years to get tenure in this institution. If it takes 3 years to build the relationship I need, does that make sense? And I would say, I guess, so I don't know if that was your question. Was that your question?
Well, I meant it more from the perspective of having the patience to build the relationships and the trust. But I think if you could answer it from that perspective, it would sure help people who are thinking about that as well.
Well, my guess is that Teresa, Sindhu, and David have thoughts about early career researchers and the strengths that they would have as part of a collaboration. I think they bring lots of not just energy, but they're often better trained empirically than those of us that have been around forever, because they're fresh out of school. But also there's, they just bring new ideas and more current in a lot of things. So I think there's lots of great things about bringing in people across their career. I would just say, on the point about how long it takes to do this kind of work, I think it depends on your institution, and it depends on what else you have going on. So if you just finished your dissertation and you can publish some publications, get some publications out from that dissertation, if you're in a Research 1 university or a Research 2 university and publications matter, then just make sure that you're able to satisfy those expectations for what your institution wants of you while you're still laying the groundwork for this partnership. The second thing I would say is I was actually just thinking about this. We have a new faculty member this year who I'm hoping to get engaged with this partnership. And I'm thinking that's the great way to do it as a early career scholar, to join an existing partnership, because you don't have to do all that slogging of setting it up, and you start to meet people who can introduce you to other people, et cetera. So I don't know, those are just a few thoughts.
How about relationships with other stakeholders like policymakers and funders? Do you have any particular approaches that you think work better?
Well, it's really helpful when someone offers to do your work or offers to give you exactly what you need. And so, I actually wasn't around when this partnership was initially incorporated, but this work that David, Julia, and Teresa are doing is something that the state truly, truly cares about and is putting a lot of our resources and efforts into. And they came to us with, I'm assuming I wasn't here, but with a way to help answer these questions that are vital to the state, right? And so it's looking at those priorities of current, possibly future state policy landscape, and seeing how do our interests fit into this? How do we sort of give value to what another are doing?
Thank you. I think we just have a couple more minutes. If you have any closing thoughts about this collaborative approach.
I mean, one thing we didn't talk about that we don't have time to talk about, but like, how is this useful to a child welfare audience? And is it just the partnership piece that's useful? We could have a whole nother discussion about how childcare is a really critical sort of social safety net for families that are involved in the child welfare system. And that's kind of a whole nother issue, but it is something that I think is relevant.
So Sanjan, if I may,
Yes, thank you.
in our last 30 seconds, I just want to acknowledge our panelists. We had like true experts in both the work that you do every day, but the blend of how you work together and brought your particular talents and expertise. It was so impressive. And I recognize the time and the effort that took to really put this type of work together, but it's so meaningful. And so I so appreciate you sharing this with our audience. And I think that either the current viewers or future viewers will get an awful lot out of this discussion. So thank you so much.
Thank you.
Yes, thank you, everybody.
Thanks for having us.
I will put up the link to our other sessions of this webinar series and where you can find the recording as well for this session. We appreciate all of our speakers today, our attendees, for joining. Thank you.
Thank you, Stephanie.